Welcome back. I'm Dr. Greg Oliver, and if you've been following our series, you already know that successful, lasting weight loss isn't about willpower. It's about science. Today, we're diving into Factor 3 of my 5-factor approach to medical weight loss, metabolic enhancement. And this topic is so important, so clinically rich, that we're going to break it into 2 parts. In part 1, we'll talk about why metabolism matters so much in weight management and what we're looking for when we run our comprehensive blood panel. In part 2, we'll walk through exactly how we treat what we find. Let's get into it. Most people think of metabolism as simply fast or slow. The reality is far more complex. Your metabolism is a vast interconnected system of hormonal signals, enzymatic processes, and cellular machinery, all of which determine how efficiently your body burns fat, regulates blood sugar, stores energy, and responds to the food you eat. Here's something critically important to understand. Obesity has a significant genetic component. Studies consistently show that genetics can account for up to 70% of a person's predisposition to weight gain. This means that for many of our patients, possibly you, struggling with weight, it's not a character flaw, it's a biological reality that requires medical response. When metabolic systems are not in balance, even subtly, the body's ability to use fat and glucose efficiently is compromised. The result? Weight comes on easily and it resists coming off. No amount of dieting will fully overcome a metabolism that is working against you. That's why my approach begins with a thorough investigation of your metabolic health. Now, that's done through a comprehensive series of laboratory tests. Every patient who comes into our office in our program undergoes an extensive blood panel. This isn't some routine annual checkup blood panel. This is a metabolic deep dive. Let me walk you through what we're looking at and why each component of this testing matters. So, what tests do we get and why? Number 1, we get a comprehensive metabolic panel, or a CMP. The CMP gives us a broad picture of your body's chemistry. It evaluates blood glucose or sugar, kidney function, liver function, and electrolyte balance. Fasting glucose is a key early indicator of insulin resistance, even before a formal diabetes diagnosis. Second part of the testing, a complete blood count, or CBC. The CBC tells us about your red and white blood cells and platelets. Anemia, for example, can cause profound fatigue that derails exercise and activity, something that might be blamed for laziness, but it's actually a treatable medical condition. The third panel is a lipid panel. We're looking at total cholesterol, LDL, HDL, and triglycerides. When we see elevated triglycerides and a low HDL, those are classic hallmarks of insulin resistance and metabolic syndrome. Your lipid picture tells us a great deal about how your body is processing dietary fats and carbohydrates. Fourthly, we look at a thyroid assessment. The thyroid gland, which sits in our neck, is arguably the master regulator of your metabolic rate. Even subclinical thyroid dysfunction, that is levels that fall kind of normal in range but are suboptimal for you, that can be meaningfully reducing the number of calories you burn each day, making weight loss significantly harder. So we take thyroid assessment very seriously. The fifth thing is insulin levels. This is one of the most overlooked tests in conventional medicine. A fasting insulin level can reveal insulin resistance years before blood sugars even become abnormal. Elevated insulin is pro-inflammatory, promotes fat storage, particularly around the abdomen or belly, and actively blocks fat burning. Finding this early on can be a real game changer with weight loss. Number 6, cortisol levels. We measure cortisol. It's our primary stress hormone, and chronically elevated cortisol is one of the most underappreciated drivers of weight gain and fat accumulation, especially visceral fat. We call abdominal fat. It also promotes insulin resistance, disrupts sleep, and kind of creates this vicious cycle. The seventh thing we look at is hormone panels. For our female patients, we assess estradiol, progesterone, FSH, testosterone, and these hormonal shifts, particularly around perimenopause and menopausal years, they profoundly affect body composition, fat distribution, and metabolic rate. Low progesterone and estrogen dominance, or low testosterone, in women can each contribute to weight gain and resistance to weight loss. We also look for patterns consistent with PCOS, polycystic ovary syndrome, which involves insulin resistance, androgen or male hormone excess in women, and is one of the most common metabolic drivers of weight difficulty in women of reproductive age. Now, for our male patients, we also look at the estradiol level, testosterone, and PSA. Low testosterone in men is strongly associated with increased body fat, loss of lean muscle mass, reduced energy, and impaired fat. Elevated estradiol in men can further suppress testosterone and promote fat accumulation. Knowing where a man's hormones stand is essential to building an effective metabolic treatment plan. So we look at all these tests. Now, we're not just looking at individual numbers in isolation. We're looking for patterns or clusters of findings that kind of tell us a metabolic story. For example, if I find elevated fasting insulin along with high triglycerides and a low HDL or good cholesterol and increased abdominal weight, that's a very strong picture of insulin resistance, perhaps the single most common metabolic barrier to weight loss that we encounter every day in our office. If I find irregular menstrual cycles, elevated androgens, polycystic ovaries seen on imaging, and an insulin resistance in a younger woman, that points to PCOS, a condition that requires a targeted metabolic strategy. When I see a sluggish thyroid, even one that's still in normal range but hasn't crossed the threshold for a formal diagnosis of low thyroid or hypothyroidism, combined with symptoms of fatigue, cold intolerance, hair changes, and difficulty losing weight, that's a metabolic drag that needs to be addressed, and that thyroid level most likely needs treated. Then, when elevated cortisol with core body obesity or truncal obesity, poor sleep, and high stress are present, the adrenal axis needs attention. That cortisol level needs attention. Every one of these conditions reduces your metabolic capacity to utilize fat and glucose the way a healthy metabolism should. And every one of them is treatable. So that's the foundation. A proper metabolic workup isn't optional in our program. It's the cornerstone of our program because you cannot treat what you haven't found, and you cannot optimize a system you haven't measured. Now, in part 2 of my Factor 3 plan on metabolism, we're going to talk about what I do with this information, medications, nutraceuticals, and other targeted strategies that we use to correct these imbalances, restore your metabolic function, and give your body the biologic environment that it needs to lose weight, and then keep it off for long term. So stay with me for part 2 of Metabolic Enhancement, where I'm going to bring all this together for you so you'll know exactly what we need to do if you have a metabolism that isn't working on your side. I'll talk to you soon. Bye now.